Here with us now is Dr. Kim Wright, OBGYN at CareSource. Thanks so much for joining us.
Thank you for having me again. Good afternoon.
So we're talking about a new study here that perhaps women can transmit antibodies, COVID antibodies, through breast milk. So tell us about first this study and why might this be?
So this study really just confirmed what we already knew. When we look at other viruses, we know that when a pregnant woman is infected by a virus or receives a vaccine, she creates antibodies. That's how our body mounts an immune response. And we know that those antibodies are small enough that they are able to pass through to the placenta, and the baby is able to receive those antibodies and benefit from those antibodies. We also know that those antibodies can also pass into the breast milk. So that's one of the many benefits of breastfeeding, is that some of the immunity that the mom has can be shared with the baby. So this study really just confirmed what we already knew about the regular behavior of viruses and our immune system in the COVID context. Mm-hmm. So as you know, COVID is new for us, and we are continuing to learn more things about how it behaves. And I think that this gives us some satisfaction in knowing that, okay, we can rely on some of that, those pathways that we're familiar with to be applied in this situation as well.
Well, I know it was interesting because early on, people were fearful that they were going to transmit the virus through breast milk, but now we found out that that's not true. And then in fact, there's some good news that antibodies, sort of this replication study, as you're saying, it's something that we have known, but sort of further evidence that we're okay. We can, a woman who has a child or a newborn can breastfeed.
Absolutely. And so I think we maybe have had an opportunity to talk about breastfeeding in the past and how there are so many benefits to the baby in terms of the breast milk being the perfect nutrition for the baby and helping the mom and the baby to bond. But now this is just further benefits to breastfeeding, is again sharing that immunity with the baby.
Well, Dr. Wright, so you said that there's other benefits, of course, where it helps the baby's immune system, but I've also read that it can actually prevent breast cancer. Is that something that is possible or known through science?
So not necessarily that it prevents breast cancer, but it lessens a woman's risk of breast cancer. Mm-hmm. So we know that women who do nurse their babies have a lower risk of breast cancer. There are actually some countries where culturally a woman only nurses on one side. And we've been able to demonstrate that that one side is less likely to develop breast cancer than the other side. So that's an interesting study that just happened in Nature. And so we do know that amongst the many benefits for both mom and baby, a reduced chance of breast cancer is one of those benefits.
Wow, just one of many. And are we talking antibodies after being infected with COVID-19 or getting the vaccine or both?
It's actually both. So whether you have what we call natural immunity, which means you've been infected and now your immune system is revved up, or whether you've gotten the vaccine, your body's response is to produce antibodies. And we know that those antibodies do pass on to the baby, and it does not matter whether your immune system was revved up by an infection or whether it's been revved up by the vaccine. The other thing we know is that the earlier in the pregnancy a mom develops those antibodies, the more robust, the better the response will be in the baby. So if a mom has COVID earlier in the pregnancy, there's more time for her to produce antibodies, and the baby has more antibodies at the time of delivery. Likewise, we can expect that if a mom has the vaccine earlier in pregnancy, there's more time for her to mount a response, and the baby has more of the antibodies in their bloodstream. So we still need to collect data, and there's still research to be done. But what this suggests is that, number one, It is recommended for the COVID vaccine to be taken by pregnant women. And number two, this may impact the timing of getting that vaccination. And we may at one point start to recommend that women be vaccinated sooner in their pregnancy rather than later.
Wow, that's so interesting that you say that. And I wanted to just add one more thing. Do you think that this might encourage who maybe thought they wouldn't consider breastfeeding in the past? What do you think their thoughts would be now knowing this?
Well, I certainly hope that it would be part of the decision-making process. So I think that there are many factors that impact a woman's decision to breastfeed. And that has to do with her social situation, her work situation, her physical situation. And I think that there are many factors that a woman considers, and it needs to be an individual decision. Certainly, as we talked about earlier, the health benefits for mom and baby are astounding. And I think that this is just another check in that column. So hopefully it all goes into the soup that a woman uses to make that decision.
Wow, that's so interesting. And it's so interesting also that we don't have a vaccine for people 16 and younger. So these newborns are coming out of the womb, possibly having these antibodies. That's really interesting.
It is very interesting. And again, we've seen this with the flu vaccine and with other vaccines. Babies oftentimes are not vaccinated for these things, but they can get that immunity from the mother, which I think is awesome and something that we certainly want to encourage when appropriate.
Did I hear you correctly that this happens with other vaccinations, that if a woman gets a flu shot, that this also could pass to the, that's incredible. Wow.
That is correct.
Babies have to be over 2 years old to get the flu shot. So they get some protection. That's incredible. Wow. Dr. Wright, thank you.